Public Health and the 10 Biomedical Institutions by Stanley Scott, Jr. Stanley Scott, Jr. sat at his desk, surrounded by healthcare journals and research papers, the San Francisco skyline visible through his window. San Francisco was not a real city, but it was entirely real. It was every city where medical innovation coexisted with profound healthcare inequity. Every community where cutting-edge research towers stood in the shadow of unaddressed health challenges. In the late 1960s, San Francisco was born from a singular vision. Dr. Eleanor Blackwell stood on an empty hillside, her voice cutting through the morning fog, declaring that this city would become a beacon of medical innovation. With unwavering determination, she convinced city officials and wealthy benefactors that healthcare and biomedical research would be the lifeblood of their urban future. The city's health metrics told a story of profound inequality. Dr. Amara Washington's digital map revealed a harsh truth. San Francisco was not one city, but many. In Hillcrest, health outcomes rivaled those of Japan or Sweden, while just blocks away in Riverdale, residents faced health challenges more reminiscent of developing nations. The cruel irony was not lost on her. Some residents were battling addictions to synthetic opioids developed in laboratories mere miles from their neighborhoods. Medicine in San Francisco was more than a profession. It was a way of life. Maria Suarez, a veteran nurse, understood this deeply. Walking new staff through the corridors of San Francisco General Hospital, she would explain that the city didn't just treat illness, it breathed medicine. Conversations at neighborhood barbecues centered on breakthrough therapies, and children played research lab alongside traditional games, their lives intricately woven with the fabric of medical innovation. The Department of Public Health emerged as a transformative force, led by Dr. Jonathan Chen. Having transitioned from emergency medicine to public health leadership, Chen understood that true healing extended far beyond treating individual patients. We can't keep pouring resources into the pinnacle of the pyramid while the foundation crumbles, he would often say, challenging the very structure of healthcare delivery and pushing for systemic approach that addressed root causes of health disparities. Public health initiatives in San Francisco were revolutionary. Commissioner Chen launched programs that moved beyond telling people what they should do, instead creating environments that made healthy choices possible. Jamal Porter, a community health worker, emphasized that healing happens at the community level, requiring people to feel genuine ownership of their health and well-being. Crisis response defined the city's medical resilience. When a Legionella outbreak threatened the population, the Emergency Operations Center became a testament to coordinated medical intervention. Commissioner Chen and Dr. Amara Washington worked tirelessly, their efforts a delicate dance of scientific precision and human compassion. For Chen, each crisis was a reminder that they were constantly surrounded by potential health threats, requiring vigilance and proactive strategy. The safety net for underserved populations became a critical focus. Dr. Michael Torres highlighted the limitations of medical interventions when fundamental social needs remained unmet. Treating diabetes, setting broken bones, or stabilizing heart failure meant little if patients lacked safe housing, couldn't refrigerate insulin, or had no transportation to follow up appointments. The Genomic Institute stood as a cathedral of scientific understanding. Dr. Elizabeth Chen saw their work as decoding the fundamental language of human health. The massive DNA sculpture rotating in their lobby symbolized the complexity of their mission, 4 simple bases repeated in endless combinations, holding the potential for transformative medical breakthroughs. At the Neurological Research Center, Dr. Robert Chen approached brain research with profound reverence. The memorial wall honoring brain donors was more than a tribute, it was a constant reminder that behind every scan, every tissue sample, every data point was a human life, someone who loved and was loved, who experienced the world through the very organ they studied. The Immunology Foundation viewed infectious diseases as a global challenge that respected no boundaries. Dr. Maya Patel drew parallels between immune system responses and research team dynamics. Both required specialized components working in perfect coordination, both demanded constant adaptation, and both depended on memory of past encounters to respond more effectively to future challenges. The Oncology Research Institute reimagined cancer not as a singular battle, but as a complex ecosystem. Dr. Elena Rodriguez taught her students that a single tumor contained genetically diverse cell populations, each evolving and adapting. The Institute's memorial wall bore hundreds of names, not just clinical records, but testaments to individual journeys of hope and survival. The Cardiovascular Studies Center approached health as an integrated system. Dr. Michael Chen emphasized that, like the heart itself, their work required specialized components functioning in coordinated rhythm. They tracked everything from vaccination rates to diabetes complications, understanding that cardiovascular health was intimately connected to broader community conditions. Regenerative medicine represented the frontier of healing potential. Dr. Sophia Park explained how they were learning to guide the body's natural renewal processes, moving beyond simply reading the genome to potentially rewriting it. Researchers like Dr. Michael Zhang explored precision genetic repairs that could address root causes of conditions rather than merely managing symptoms. The Mental Health Research Collaborative confronted the complex legacy of psychiatric care. Dr. Elena Washington used their renovated facility, a former psychiatric hospital, as a constant reminder of both medical progress and the need for humility. They focused on early intervention, recognizing that most adult mental health conditions show initial signs during childhood or adolescence. The Pharmaceutical Development Institute prioritized impact over profit. Dr. Michael Zhang emphasized the complexity of modern pharmacotherapy, while Dr. Elena Rodriguez insisted that any commercialization agreement must include provisions for affordable access, equity considerations, and transparency. The Environmental Health Sciences Center embodied the principle that human health could not be separated from environmental conditions. Dr. Elena Rodriguez passionately argued that the air we breathe, the water we drink, the food we eat, and the spaces we inhabit all profoundly influence our well-being through complex, bidirectional relationships. The Robotics and AI Medical Laboratory sought to develop technology that served human needs. Dr. Michael Zhang was adamant that in healthcare, where vulnerability and human connection were paramount, technological tools must enhance rather than diminish the human dimensions of care. San Francisco Children's Hospital approached pediatric care as a holistic discipline. Dr. Catherine Chen emphasized that children weren't simply small adults but required distinct physiological, developmental, and psychological considerations. Every aspect of their facility adapted to these unique needs. Children became the unexpected heroes of this medical narrative. At San Francisco Children's Hospital, a young patient in Spider-Man pajamas would wave to doctors while pulling an IV pole, transforming medical challenges into moments of unexpected joy. Nurse Sophia Rodriguez understood these children were more than patients. They were health ambassadors, teaching their families about wellness through their own resilience. The robotics wing of the Children's Hospital represented a delicate balance between technological advancement and compassionate care. Dr. Michael Zhang designed the space to communicate that remarkable technology should serve fundamentally human purposes, enhancing the warmth of pediatric medical care. Sacred Heart Hospital integrated faith and medical practice. Sister Elena Garcia explained that their Catholic identity provided an ethical framework that shaped their approach to healthcare, recognizing that medical care alone could not address the complex needs emerging during serious illness. The Industrial Workers Medical Center honored the physical sacrifices of labor. Dr. James Chen recognized that their patients' bodies bore the direct cost of building infrastructure, manufacturing goods, and maintaining essential services. Their mission extended beyond treatment to advocacy for preventative workplace conditions. San Francisco General Hospital stood as a provider of last resort. Dr. Jonathan Chen understood their critical role in a healthcare system where market forces typically determine service distribution. They ensured care remained available to all, regardless of resources or circumstances. The medical professionals of San Francisco represented diverse expertise and commitment. From emergency physicians grappling with complex administrative challenges to nurses leading intricate ICU rounds, they embodied a holistic approach to healthcare that extended far beyond clinical skills. At Sacred Heart Hospital, Sister Elena Garcia understood that healing transcended medical technology. Her prayer teams recognized that true wellness involved the spirit as much as the body. Moments of unexplained recovery, like young Sophia's remarkable improvements, suggested dimensions of healing beyond scientific measurement. The economics of healthcare revealed complex funding dynamics. Dr. Robert Jackson highlighted how public insurance programs, despite lower payment rates, provided the most reliable funding streams, forming the backbone of operational sustainability. The city confronted the painful reality of those left behind by the healthcare system. James Chen, speaking from his experience of homelessness, articulated how survival priorities often pushed medical care to the background when basic needs remained unmet. The addiction crisis exposed the intricate relationships between medical research, individual suffering, and systemic challenges. Maria Chen's journey of recovery illustrated the complex path from substance abuse to healing, highlighting the need for comprehensive, compassionate approaches. Her daily methadone treatment was more than a medical intervention, it was a pathway to reimagining her life. Each morning's dose represented not just chemical stabilization, but a radical act of personal reclamation. Labor conditions and healthcare intersected through union advocacy. James Wilson and the nurses' union fought for staffing standards that protected both patient care quality and healthcare workers' well-being, recognizing that these were fundamentally interconnected. City politics became a critical arena for healthcare transformation. Chair Michael Chen and Mayor Gloria Washington navigated complex considerations, balancing technical evidence, community perspectives, institutional viewpoints, and fiscal constraints to make healthcare funding decisions. Underground economies and systemic challenges threatened to undermine healthcare initiatives. Dr. Elena Martinez studied how these informal systems emerged from the interaction between market demands, institutional limitations, and individual needs. Corruption and exploitation within the healthcare system demanded constant vigilance. Maria Suarez and Dr. Sofia Martinez emphasized that healthcare workforce conditions directly impacted care quality, highlighting the need for living wages, comprehensive benefits, and meaningful professional voice. Moments of unexplained healing challenged scientific understanding. Sister Elena's prayers and Dr. James Wilson's medical observations suggested that healing transcended technological capabilities, pointing to dimensions of experience beyond current scientific explanation. Cutting-edge medical technologies raised profound ethical questions. Dr. Sofia Martinez and the Ethics Committee grappled with the implications of genetic interventions, recognizing they were not just treating individual patients but potentially altering entire family genetic trajectories. Public health reform demanded collective vision and commitment. Commissioner Chen argued that they possessed the scientific knowledge, technological capability, and moral imperative to create an equitable healthcare system. What remained was cultivating collective political will. The path toward a healthier city required continuous adaptation. Dr. Elaine Rodriguez emphasized that their goal wasn't perfection but a genuine commitment to improvement, a willingness to listen, adapt, and recognize health as a dynamic, collaborative journey. The delicate balance of science, faith, and compassion emerged as San Francisco's defining characteristic. Maria, now a community health leader, articulated that healing transcended any single approach, requiring connection to bodies, to each other, and to something larger than individual experience. The groundbreaking of the Veterans Affairs Hospital represented a profound moment of commitment and hope. On a crisp morning, the eastern edge of the medical district came alive with anticipation. Red, white, and blue bunting decorated the podium, and a diverse crowd gathered, veterans in various service uniforms, healthcare workers, city officials, and media representatives. Mayor Gloria Washington approached the podium with a sense of solemn purpose. Her speech cut to the heart of the matter. This was more than a new building. It was a renewed commitment to those who had sacrificed for the nation. She spoke directly to the veterans present, acknowledging the fragmented healthcare system they had long endured, one that forced them to travel hours for specialized care and navigate impossible bureaucratic hurdles. The architectural renderings displayed beside her told a story of comprehensive care. This hospital would not exist in isolation. It would be fully integrated with San Francisco's medical ecosystem, collaborating with research institutes, training facilities, and community clinics to ensure veterans received coordinated care that addressed their unique needs. James Wilson, representing the nurses' union, brought a critical perspective to the ceremony. With 79% of the vast projected workforce to be represented through collective bargaining, he emphasized that quality veterans' care was inseparable from quality working conditions. Many of the nurses and staff were veterans themselves or came from military families, bringing not just professional expertise but personal commitment to the mission. Francisco Ramirez, a 72-year-old Vietnam veteran in a wheelchair, became the ceremony's emotional centerpiece. With tears in his eyes, he spoke of waiting 40 years to see this day, a day when his fellow service members would finally have care that understood their experiences, body and soul. When invited to participate in the groundbreaking, he accepted a ceremonial shovel adapted for use from his wheelchair, adding his own scoop of earth to symbolize years of waiting and hope. In a quiet moment after the ceremony, Dr. Jonathan Chen and James Wilson reflected on the deeper implications. They agreed that veterans' health needs didn't fit neatly into typical healthcare frameworks. True integration would require shared data, coordinated care paths, and a unified approach that recognized the unique experiences of those who had served. As the construction site stood as a promise of transformation, it embodied more than a medical facility. It represented a city's commitment to healing, not just of bodies, but of experiences, of systemic oversights, of the profound connection between service, sacrifice, and comprehensive care. As dawn broke over San Francisco, the medical district stood as a living testament to human potential. It was a landscape of contradiction, where breakthrough technologies existed alongside persistent inequities, where scientific innovation coexisted with deep-rooted social challenges, yet continuously striving to transform healthcare into a more just, compassionate, and holistic practice of healing.